Director General of Health, Dr Ashley Bloomfield, has resigned, as you will know, and two other top health officials are walking away from the job as well. It comes ahead of a major health shake-up that's removing DHBs, they're gone, and creating Health New Zealand alongside a Maori health authority. Here to discuss is Health Minister Andrew Little. Morena, good morning.
Morena, Ryan.
Did he resign to you? Did he give you a call to let you know?
He rang me in the weekend to say what he was doing, but he, for his employment, he talks to the Peter Hughes, who's the head of the Public Service Commission.
What did he say on the phone?
Oh, he just said, and look, I was aware that he was thinking about what he would do. He just said to me, look, he's had 4 years in the job, he's had 2 years leading the response to the pandemic. He's just exhausted, and that's not a surprise because I've seen that in him. I've worked more closely with him in the last year or so myself. He's done a fantastic job in that respect, and it doesn't surprise me that he's feeling that way. And then knowing that with the reforms there'd be a change process within the ministry, and I think he just decided that he didn't want to be doing that.
So he didn't want to be involved with that. Is that because of already concerns about actually who's going to be in charge with these reforms? Was there any inclination from him that he was worried about being sidelined?
No, not at all. I mean, we are still going to have a Director General of Health after the reforms, and the Director General of Health will still be kind of the leader of the health system, the apex of the health system. But the ministry itself is still going to require some change. There's some people who are being transferred into Health New Zealand and the Maori Health Authority. There's more of that to go. But also just focusing the ministry on what we need it to do, that it does best, which is the policy development, the analysis, the advice to ministers and those sorts of things, and being kind of the overall system sort of steward. But that's going to require some change within the ministry, and I think he just decided that given everything he's given of himself in the last 2 years, he just didn't have enough to give.
Fair enough.
That work.
No, that's fair enough entirely. But I'm just wondering, with this new, you said that the Director General of Health will still be the top dog in the health system, which is interesting because you've now got these three different agencies that will be created, including the Ministry of Health. And I'm just talking here about a New Zealand Herald report this morning, which spoke to Derek Cheng, spoke to a health insider. And this is the quote. It's going to get very messy. The dynamic between the Ministry, Health New Zealand and the Maori Health Authority is strained. There are major power games going on. Are you worried you're creating a monster here?
No, not at all. And that's a very interesting insight from one person in a system that employs over 80,000. So let's just get some perspective on this. Look, the Health New Zealand and the Maori Health Authority are working absolutely hand in glove together, which is what we wanted, and they're doing an amazing job. That has been enabled by the ministry and leadership by people like Ashley, who have worked with the transition unit to make sure that these changes are happening. So I don't detect any major problem there. I think there'll be some people in the ministry who will know that the ministry is going to reduce in size. There will be a refocusing, but people have been expecting that and knowing that. So none of that is a surprise.
All right, let's talk about how effective it will be for outcomes, this new structure that you are introducing. We've been talking this morning about Maori health outcomes and the fact that they have a life expectancy 7 years less than their European counterparts, right? So how would you describe that in one word? Appalling?
Yeah, well, I think that's shameful, and that just reflects the systemic lack of access to healthcare and the sort of things that many of the rest of us expect as a matter of course.
Okay, so we need to make sure that whatever changes you're making will have an impact on those outcomes. So what's your target this morning for those who are watching? What is your target for that life expectancy gap for this new agency, which we're pouring billions by the end into?
Well, we'll see in the budget what's going to go into it. But look, we need to close that gap as much as we can, as soon as we can. I can't put a time frame on that.
Do you have a target?
Happen over a matter of years.
Do you have a target, though? Because it's important to have targets, isn't it? To make sure that we don't just create another layer of bureaucracy that does nothing, we need targets.
Sure. Well, the aim is to reduce that completely. If you want to set a meaningful target, a measurable goal, it is that we have more Māori getting access to services in a way that they don't at the moment. And in a sense, we can do what we did off the vaccination campaign. When we handed over leadership and responsibility for the vaccination campaign to Māori, we saw a massive difference, a massive lift and uptake of the vaccination amongst the Māori.
Yes.
It's effectively what we want to do with the Māori Health Authority.
Okay.
Say to the Māori Health Authority, you take over leadership, running it, you know how to get to your people, you get to your people, you make sure the services get to your people. More access to those services will mean that we'll improve life chances for Māori.
Okay, but there's a difference, isn't there? With the vaccine rollout, we gave it to local Māori organisations who were in their communities. With this, the $22 million you've spent on the Māori Health Authority so far has largely gone on bureaucracy. $3.2 million setting up boards that come under the authority, which you're still setting up.
Okay, so there's the way bigger perspective here. The $22 million was a development funding to get some stuff underway.
Yeah, but start how you intend to carry on.
And some of that $22 million has gone into ensuring that frontline services are developing their staff.
How much of it?
The Māori Health Authority's job.
About $3 million?
I don't have the figure off the top of my head. Can I just finish answering your first question, because this is important, because you're focusing on what the Māori Health Authority will do. They will also be directly commissioning Māori Health Services. So we have a bunch of Kaupapa Māori Health Services at the moment. Ministry commissions them. That role will transfer to Māori. They will work with those Māori Health Services to get the best out of them, provide the development, add to the staff they need to do, work with them to develop their coverage and their reach, if you like, and so that there's a bunch of services tailored to Māori, particularly those who struggle to get access to health services. The frontline services will be delivered by Māori health organisations.
Okay. Will you ever look at, say, giving a preference on a surgery waitlist to somebody who's Māori ahead of another ethnicity?
I'm not sure that ethnicity alone would dictate that. If there are other, circumstances, health vulnerabilities and so on, that might move you up the list, and it should move you up the list.
But ethnicity, you would never use ethnicity in that way.
We'll never say just because you're Māori, in the same way as we say just because you're European, therefore that means you get higher up the list. But if you are in a household where you're exposed to a whole bunch of other risks or threats or disease, or you've got diabetes, or you've got a range of other conditions,
totally,
those are the things that move you up
but that's,
the list for medical services.
Yeah, those are clinical judgments which are made now. That you're saying, you're ruling out that ethnicity would ever be used to bump someone up a surgery wait list.
Not for a surgery wait list. Where we do see a difference is, so for example, in the bowel screening program that we've all just completed rolling out, the next phase is to look at different population groups. So statistically, Māori are prone to colon cancers and bowel cancers and so on earlier than European populations. So we are actively looking at whether we allow Māori to get access to that screening process earlier by age than European, because it makes sense epidemiologically to do that. So there's those sorts of things that might make a difference.
But not with
on a surgery list, probably not.
Okay. Just in general, before we go this morning, Minister, because it sounds all very well and good, and we've heard about reforms of the health system before. You haven't committed to any targets with me this morning on reducing that gap, and no timeframes either. We've been talking on this program for a number of weeks now about nursing shortages. We've been talking about cancer screening targets for breast cancer. We've been talking about it for cervical smears as well, the backlog there. Can you give us can you commit this morning to actually putting in place some targets so that when we go and spend all this money, we know whether it's valuable and money well spent or not?
Yeah, we already have a bunch of sort of standing measures about whether or not the health services are delivering what we need them to deliver. So they are in place at the moment. I think in terms of the stuff you're talking about, particularly where there's been a backlog because of disruption caused by COVID and what have you, the screening processes, the diagnostic processes, even the surgical procedures. We are in the process of planning at the moment about exactly how we tackle that, because we do need to. That will come with some pretty hard measures about that. You'll hear more about that in the next few weeks.
Okay, so we will have targets on catching those up.
You'll have some numbers put around what we think we can do, how soon we can do it.
All right, Minister, we thank you very much for your time this morning. As always, that is the Health Minister, Andrew Little.